Welcome to this presentation on a study entitled Tuberculosis Incidence Rates and Their Social Determinants 2005 to 2015, an ecological analysis across 116 countries to support TB prevention. TB remains the biggest infectious killer in the world, and there is a strong global commitment to ending the epidemic. However, the current global trend in TB incidence decline of approximately 1.5% annually is lagging far behind the projected 10% that will be necessary to achieve ambitious goals set by the SDGs, as well as the End TB strategy. It is therefore important to better understand the determining factors of global TB incidence trends. We conducted a study that evaluated associations between national TB incidence rates and trends in social determinants of health. The study took a longitudinal ecological design covering 116 countries over a study period of 11 years. The study sample included 24 of the 30 countries defined by the WHO as having a high TB burden, including the 8 countries that account for 2/3 of the global total of incident TB cases. The study outcome we looked at was age and sex standardized TB incidence rate estimated by the Global Burden of Disease study. We chose 17 indicators of intermediary and structural determinants of health as hypothesized predictors of TB incidence rate. Based on the conceptual framework for action on the social determinants of health, the study variables were categorized into indicators of socioeconomic and political context, socioeconomic position, and intermediary determinants of health. The data we used was collected from publicly available online databases, including the WHO database, the Global Burden of Disease study, the ILO, and the World Bank database. Associations were estimated in univariable and hierarchical multivariable Poisson regression models. We used country-level and year fixed effect specifications for panel data and conducted the analysis across all countries as well as stratified by country income groups. Moving on to the results. A decline in TB incidence rate was observed in 108 out of the 116 countries included in the study. In univariable analysis, 14 of the 17 investigated indicators showed a significant association with TB incidence rate. Overall, and in low and middle income countries, progress in health expenditure per capita, human development index, prevalence of diabetes, prevalence of undernourishment, and TB case detection rate were associated with steeper declines in TB incidence rate. Of these key correlates, prevalence of diabetes was retained in the final adjusted model. In high-income countries, some differences were observed. Progress in public social protection expenditure, under-5 mortality rate, and access to clean fuels and cooking technologies was associated with steeper declines in TB incidence rate. Among these indicators, access to clean fuels and cooking technologies retain significance in the final adjusted model. In conclusion, the results of our study suggest that diabetes prevalence was a key intermediary determinant of global trends in TB incidence rate between 2005 and 2015. Progress in structural determinants of health at socioeconomic and political level, as identified in our study, was associated with steeper declines in TB incidence rates. Our findings add to evidence that investments in health, social protection, and broader human development addressing the key intermediary determinants of TB incidence rate may help accelerate future TB incidence decline. I would like to end this presentation by thanking my co-authors, Dr. William Rutgard and Dr. Christy Annestad, for the great support, and I would also like to thank SPARKS for giving me the opportunity to present today. Please do not hesitate to get in touch with me if you have any questions or comments. I would be more than happy to discuss further. Thank you very much for your time.